Hello, I'm Trisha Ward from Medscape Cardiology, and I'm at the 2022 American Heart Association Scientific Sessions in Chicago, where I'm joined by Dr. Luke Laffin of the Cleveland Clinic. Welcome, Dr. Laffin.
Thanks for having me.
So you just presented the SPORT trial, which randomized some Ohio residents with LDL cholesterols between 70 to 189 milligrams per deciliter. They were not on statins or supplements, and they were assigned to either low-dose rosuvastatin versus one of 6 over-the-counter supplements. Do you want to tell us your key findings?
So our key finding, based on the primary endpoint, was that rosuvastatin was vastly superior at lowering LDL cholesterol over the study time period compared to placebo and any of the supplements. What we also found was it was better for lowering cholesterol and serum triglycerides.
And of the supplements, can you tell us what they were that you compared it against?
They were turmeric, cinnamon, garlic, fish oil, plant sterols, and red yeast rice.
Red yeast rice before has been shown to lower LDL in some other trials. So why do you think it was different here?
Well, I think with any of these supplements, it's really dependent on the manufacturer and what we see. And that's one of the problems with them, is that they're not FDA regulated, okay? And so you can have very different effects based on which one you choose.
And how did you choose these 6?
Well, initially we started by just saying, what are our patients taking? Okay, they come to us. I would say at least half my patients that I see for preventive cardiology reasons are taking at least one of these. Okay, so we looked at the most common ones. We looked at some market research about what are people taking for quote unquote heart health or cholesterol health, and we found these, which are very popular supplements.
And now it wasn't just that some of them didn't lower LDL, but there was even some opposite effects, should we say?
Exactly. What we saw when we looked at, we also compared them directly to placebo. And what we saw was that actually garlic, which is the garlic supplement, increased LDL cholesterol compared to placebo by 7.8%. And plant sterols decreased HDL cholesterol compared to supplements. So they weren't, it wasn't completely neutral either. It was potentially even harmful.
There was a fish oil in this as well. Now that's an over-the-counter fish oil. Was that a combination DHA, EPA product?
That was a combination product as well.
At a relatively low dose.
Yes, exactly. 2,400 milligrams was what we studied. And what we used for any of these supplements was the dose right on the bottle. Okay, so we didn't differ from what the manufacturers actually tell people to take.
And this was a relatively short trial, 4 weeks.
It was, and the reason for that is that's really all you need to see this difference. If you look at the 2018 American Heart Association, American College of Cardiology lipid guidelines, they recommend checking a repeat lipid panel after you do any type of lifestyle or start a statin anywhere between 4 and 12 weeks. So we chose 4 weeks.
And now you also looked at inflammatory markers with high sensitivity CRP. What did you see there? So
we didn't see a change in inflammatory markers with rosuvastatin compared to placebo or any of the supplements. And it's probably because it was a smaller trial, but also most individuals in the trial actually had a normal CRP to begin with.
So there probably wasn't any inflammation there to lower.
Exactly.
And now how would you describe these patients with that level of LDL, and they didn't have prior CAD?
Exactly. There was a primary prevention group. 60% of participants enrolled were women. Okay, they were generally in their mid-60s. LDL cholesterol, the mean LDL cholesterol was 128 milligrams per deciliter. So they were a pretty average patient that we would see. If we looked at their 10-year risk of a stroke or heart attack, it was right around 8%. So we would classify these as intermediate risk patients based on the current lipid guidelines.
And what would you like people to take away from this? Because we've seen before that there's been negative data on supplements, and they still seem to keep selling.
Well, I think that the head-to-head nature of this and the randomized sort of strict criteria that we used for the trial hopefully can inform discussions, okay? Physicians, any medical provider and these patients, and they can show them the figure in the manuscript as well, right? Looking and seeing. If you see that you take a statin, your LDL cholesterol is going to go down. You take one of these supplements, you might as well flip a coin and see, is it going to go up? Is it going to go down?
And how do you think clinicians should speak to their patients about supplements or ask about them? Because some patients don't want to tell the doctor they're taking them.
Right. Well, I think it's important to ask, number one, and it's not just because they don't do anything, but as we talked about, they could do harm. And it's not just from a cardiovascular perspective. There's all kinds of drug interactions that have been described with supplements and other non-cardiovascular medicines. So it should be a discussion in our clinic. We make sure that we mention and talk about supplements with patients, and it doesn't have to be some religious sermon that we give them saying, you can't take this, but it's giving them that education, right? And most people are pretty open to that and saying, oh, I can save my money. It's not helping me. Sure, I don't want to take another pill. So it's being able to provide that background information, make them feel safe that they're doing that.
Okay. Is there anything else you want to share with our audience about what you hope will happen?
Well, I think that people should also understand that low-dose statins are very safe, right? There's a lot of beliefs out there that statins have this cadre of adverse side effects, but we didn't see that. Actually, numerically, plant sterols and red yeast rice in our trial had more adverse events or side effects than statins. They didn't cause muscle aches. They didn't cause any neurological problems. No significant elevation in liver function tests. So these are safe. Try and use the evidence, FDA-approved guideline therapies rather than some over-the-counter supplements.
Okay, well, thank you very much for joining me today.
Thank you.
And thanks to our audience for listening.